Does medical imaging show my COPD airflow limitation? Imagine trying to see a breeze with a camera. You can't really see the wind itself, but you can see what it moves. That's similar to how medical imaging works for COPD. Chronic obstructive pulmonary disease is a long-term lung condition that makes it hard to breathe. The main issue is airflow limitation, which means air can't flow out of your lungs as easily as it should. This happens because of damage to your airways and lung tissue, often from smoking or exposure to irritants over time. The most accurate way to measure airflow limitation is through a test called spirometry. It measures how much air you can blow out in 1 second and compares it to your total lung capacity. If the ratio is below a certain level, it shows you have airflow limitation. This test is the gold standard for diagnosing COPD. Now, when it comes to medical imaging like chest X-rays or computed tomography scans, they do not directly measure airflow. Instead, they show the structure of your lungs. For example, a chest X-ray can reveal signs of lung damage, such as enlarged lungs or signs of emphysema, which is destruction of lung tissue. But it is not detailed enough to detect early or mild airflow problems. Computed tomography scans are much more detailed. They can show the extent of emphysema, airway wall thickening, and other lung abnormalities. These scans help doctors see the physical changes in your lungs that often come with COPD. They are especially useful for planning treatments or surgeries. While imaging cannot tell you exactly how much your airflow is limited, it provides important clues. For example, some people might have significant lung damage visible on a CORT scan but still have normal spirometry results. This can happen in early stages of COPD or in people at risk. Imaging helps identify these cases so doctors can monitor and treat them early. Using both spirometry and imaging together gives a clearer picture of your lung health. If you have symptoms like shortness of breath or a chronic cough but your spirometry is normal, your doctor might order a CORT scan. This can reveal hidden lung damage that might not show up on lung function tests. In some cases, imaging can also help decide if you are a candidate for certain treatments. For example, if your CORT scan shows severe emphysema, you might benefit from procedures like lung volume reduction surgery. It can also help rule out other conditions that might mimic COPD. In summary, medical imaging does not directly show airflow limitation. Instead, it reveals the structural changes in your lungs that often cause or accompany airflow problems. Combining imaging with spirometry and your symptoms gives your healthcare team the best chance to understand your condition fully. If you have questions about your diagnosis or how imaging fits into your care, talk to your doctor. They can explain what the tests mean for you and your treatment options.